we're discussing about the polyarteritis nodosa, right? So these are some of the classical symptoms that people like come with. Like for example, like the systemic symptoms like fever, like you have weight loss, weakness, and fatigue. You have to remember that these are classical symptoms. Also, like they come with like muscle pains. They have a diffuse like extremity pain. This is very important, right? And on top of that, you'll have a skin lesions too, like a skin purpura and all. You also have to remember there is a there's a kidneys involved too, so that's why you can have a hematuria where there's a you can see blood in urine, so you can get a glomerulonephritis too. So as like if you have a kidneys involved, you're going to have a high level of creatinine, and that is something very important that you have to remember at this point. Look, there's a GI involvement is also there, because remember whenever we're talking about polyarteritis, we're talking about many blood vessels that is actually involved here. So if the GI is involved, then you're going to get abdominal pain and rectal bleeding. This is very, very important. You can get melena, right? If there is a central nervous system is involved, you can get confusion, stroke, you can get asymmetric polyneuropathy, you can get, if it's like your testes can get involved if you're a man, and that can give you like testicular pain. If his heart is involved, you can get like hypertensions. That's very important. You could have a claudications, right? You could have ischemia and necrosis. Like, these are some of the classical symptoms that you can get. Remember, this polyarteritis nodosa, it does not include, let's just say, pulmonary arteries, all right? Remember, it's the arteries that doesn't involve, but it can create like a cavitations and all that could happen. But what I do want you to remember is this risk factor, because this plays a very, very important role. A lot of times, around like 30% of times, right? Usually, especially in the clinical vineyard, they oftentimes they like to mention this, the risk factor of hepatitis B. Okay, so usually the middle-aged person coming with hepatitis B or hepatitis C and having all these like problems like fever, hematuria, abdominal pain, rectal bleeding, and testicular pain, and you basically have asymmetrical sort of like symptoms, then that could be polyarteritis nodosa. Even some of the risk factor like amphetamine, this can also result into polyarteritis nodosa. Please remember the symptoms, because board loves to ask you questions regarding polyarteritis nodosa. All right, now other thing that you have to remember is the histological aspect of it. So if you look at it right here, right, what we're trying to make here is this, that this is a conditions where there's a segment, like different segment of the blood vessels involved. But whatever the blood vessels involved, it basically, it's transmural, meaning that all the walls of the blood vessels is actually involved. Look at this. And what they give you is like basically something called, what is this? Look at this. This is where a lot of this polymorphonuclear cells, remember there is a lot of this neutrophils are basically this infiltrations of this inflammatory cells, mainly neutrophils or polymorphonuclear cells you'll see right in this case, and that can give you something called necrotizing vasculitis. Remember, you have to remember it's a segmental transmural necrotizing vasculitis. And remember, some of those white cells, like white blood cells, they can get fragmented, right? And when they get fragmented, what happens? Those the white blood cells, they become what? They become leukocytoclastic. So that's why sometimes they also call this disease as leukocytoclastic vasculitis, because it's a fragmented like polymorphonuclear cells you see. All right, it is a very, very important that histologically you should able to distinguish this. All right, remember this is what it's a transmural necrotizing vasculitis, which is segmental. It's important that you remember this. All right. And if I wanted to make this even more clear right here, look at this, all this like homogeneous, like sort of like eosinophilic type of materials are that you see here, right? This is a classical for what? Fibrinoid necrosis. Remember, it's a homogeneous sort of like making a eosinophilic or granular sort of a patterns. This is, and you see like a lot of these neutrophils or these inflammatory cells are there, right? So this is a classical finding that you see in a polyarteritis nodosa, right? It's very important. Even like, I try to make a point right here, down here. So this is something that you have to remember. Now, other thing you have to remember here is that, look, if you look at this image, right, look at this, all this image right here, right? Whenever you look at this, because they involve segment, this segment, and this segment, right? Sometimes this, whenever you look at it like angiogram, right, this appear as more of as the rosary sign. They describe this as a rosary sign, or sometimes they say this as a beads of a rosary. All right, and this is one of the important diagnostic clue for the polyarteritis nodosa. Remember that this beads of a string or rosary sign, You could see this in other condition also. That condition is called fibromuscular dysplasia. But remember, fibromuscular dysplasia is what? It is a non-inflammatory conditions. But this polyarteritis nodosa, this is an inflammatory conditions. Okay, so this is also that you have to keep in that mind when you're answering the questions, right? And then usually, like if you want to treat the patients with polyarteritis nodosa, depends on the severity of the disease they're actually coming with. But usually these are the treatment you can do with the glucocorticoids, or you can also give something called like cyclophosphamide. Usually this is the treatment, but if they're resistant to this, then you can give a glucocorticoid for the treatment like prednisone. All right, thank you.